Hey, good morning, friends. Ahmed Mustafa, paramedic in Northeast Monroe County and with Northeast Quadrant Advanced Life Support and Webster EMS. And good morning. This morning I was going to spend a little bit of time and talk about some input we have from the New York State Governor and from our county executive, Adam Bello, and our county medical director, Dr. Michael Mendoza, who are all talking about, May 15th, what's going to happen when we come back into service and when things start to slowly return to normal and we start opening things up. And I thought about that a whole lot yesterday. I had I was on a great call with Dr. Mendoza. He's a man I have not had the privilege of meeting yet, but for the number of calls I have listened to him on and the energy and guidance he has given all of us in this county to help keep our COVID illnesses and death rates low, he's a man someday I hope to meet. But that's going to be a discussion for another day, because earlier in the evening, as I was kind of thinking about my notes and what I was going to say, a dear friend of mine, Jack, one of my fellow firefighting brothers, sent me an email link to an article about first responder suicide. And it kind of distracted me, shook me a little bit, and I said to Jack, we've got to talk to people about this because it's the topic nobody wants to talk about. And, there was recently a 3-month new EMT in New York City that took his life. There was a doctor in New York City who recently took her life. And I don't know what the history was. I don't know what motivation or what troubles they had that took them to that point, and I don't care. What I want to do today is I'm going to ask every one of you that is listening to this video to put down what you're doing and listen for 1 second. And if you're a first responder and a person I consider one of my brothers, whether it's in Monroe County, Livingston County, Wayne County, Steuben County, New York State, the United States, or some of the countries I've had the opportunity to visit, China, all the countries in Europe, Costa Rica, Brazil, France, Arnaud, who I met in France right before one of the big tragedies there. If you are one of my first responder brothers, whether I know you directly or not, I want to say, are you okay? If you are one of my nurse friends who is working in an ED or in a hospital during this mess, or one of my medical friends, or one of my cousins who are doctors, or one of my uncles who are doctors, or any of the people I know who are physicians, including my birthday brother, John Hilmy in Texas, I want to ask, are you okay? And what I want to do is I want everybody who is not a first responder, people who are working at home, people who are not working these days, people who are watching all the news media and saying, man, that sucks, I'd hate to be one of them. I want you to think about all of us first responders, whether it's the 911 dispatcher who's taking the calls at the beginning of this event, all the way up to people at the other end in the medical examiner's office or even the funeral home directors. It is the 911 dispatcher who dispatches the fire, the police, and the EMS. It is the medical director, in our county, Dr. Cushman, who is giving us guidance. It is the doctors and nurses we are bringing our patients to. It is the folks in the nursing homes who are taking care of some of these people as they either are rehabbing or recovering from some of this illness. It is even the medical examiner who's going to some of these people's homes when we are either not successful or too late in reviving them. It is even in some cases the funeral home directors who are having to deal with these patients and are struggling with that. There is a long list of people who have not skipped a beat during this entire coronavirus epidemic. They will be there. They were there yesterday. They will be there tomorrow. Whether there's an epidemic, a pandemic, a flu, we don't care. We are there for you every single day. And you know what? I think if you are not one of us and you know one of us, I have a favor to ask. I would like you to first click this Facebook page and mention them by name. Recognize them at least on this Facebook page. Northeast Quadrant Advanced Life Support, click, hey, such and such, I know you and thank you for what you're doing. And then the next thing I want you to do, I want you to call them, or I want you to text them, or I want you to email them and say, we appreciate what you are doing. Because you know what? Too many people are out there saying, oh, I need to get back to work. I need to get back to my boat. I need to get back to my motorcycle. I want things to return to normal. Well, for a lot of us, normal never stopped. In fact, normal got worse. Normal got, on top of having to go to sick and dying patients or dealing with people who are crying for help on the telephone when they call 911, or trying to figure out how to keep a healthcare system working and all the responders safe, like our people in the Emergency Operations Center are doing. There are a lot of people who said, well, I'm watching the news and it really kind of sucks and it's inconvenient. Well, there are a lot of us who that's not the case. There are people in my peer group who are staying in hotels so they don't infect their family. There are people who are being asked to work extra hours because the call volume is high. There are people being sent into hot zones in New York City and other regions because there's a need. And we aren't taking a break, right? We are out there making sure that our community stays safe. And I think those of you who are not in that first response chain of survival, I'd like you to say thank you. As I said, please click the link and mention them by name here if you can. And then when that's done, I would like you to please call them, text them, email them, and check on them. Say thank you. Let them know they're appreciated. Let them know that you are aware of all the things they're doing to keep you, your family, and your community safe. Because the reality is, every article I read about someone who has lost their life is senseless. It is because we did not take the time, whether it's their brothers and sisters, we, their family, we, their community. I don't know who the we is. But there should be no one out there in the first responder world taking their lives because of the stresses that are built up that no one can see. There's no bruise, there's no broken bone, there's no crying and screaming. Most of us keep it locked inside. I call it keeping the squirrels in the cages, right? Until one day there's too many squirrels, the cage breaks, and then we take drastic action that is often not good. So please take a minute and recognize a first responder. Whether they're one of our friends at ECD, the emergency communication, the 911 centers that are taking the calls, these are the first people in the chain of survival. Whether it's a police officer, a sheriff's deputy, a firefighter, an EMT, a paramedic. Whether it is a nurse, a certified nursing assistant, someone that is working in a nursing home, whether it is a doctor who is manning the emergency rooms, whether it's a respiratory tech who is keeping the ventilators going, a pharmacist who is making sure we all have our medicines in these challenging times, whether it's someone you might know at the medical examiner's office in your town or community, whether there's a funeral home director who might have to be dealing with some of these patients who don't make it. Please reach out and check on them. I do not want to read any more articles about people who have lost their lives because of this stupid illness or because of PTSD that no one thinks about and people are afraid to talk about. So that's my request today. I hope you will do it. I hope you and your family are well, and we'll talk more tomorrow or later about how we should follow the directions of our leaders and slowly get back to what we call the new normal. Thanks everybody for listening to me. Be well, be safe. Take care.